And he developed natural family planning. Of course, Mother Teresa's is here. They all learn natural family planning, and they teach it worldwide, right? It's a marvelous thing. Another one is, some of you I know have learned from Dr. Tom Hilgers. He's one who read Humanity and said, as a healthcare professional, this sets my agenda for the rest of my life. I have to learn the most scientific ways to help women control their fertility and teach it to them. And he has an incredible wisdom and scientific knowledge on this. Look into it if you're really looking for some good training. There's a book at onemoresoul.com where they have marvelous materials. They have a book called Physicians Healed, and these are the personal testimonies of 15 courageous physicians who do not prescribe contraception. Painful. It's absolutely painful for a physician to have to stop doing something that his practice and his training have taught him is good to do. Here we have one of the Simpsons saying, it's such a struggle to always be so right, all right? I don't know, there we have, all sorts of voices, consciences. It's hard. It's hard to be faithful to our conscience. But again, it's ennobling, right? It's the good thing. There's a marvelous story about Dr. Ken Hardy. I haven't listened to this particular CD, but I've heard him give his testimony. He's a doctor who prescribed contraceptives for years and has the most amazing testimony to give about his deciding not to and starting a practice in which it wasn't involved. I've got a little book, Life Issues, Medical Choices, written with a man named Christopher Kaiser on bioethics. My materials you've already seen. It's a great book by Bill May on Catholic bioethics and the gift of human life. These are the sorts of things that Catholic health professionals should be devouring, all right? U.S. bishops have marvelous directives on healthcare. In Section 770, they say Catholic healthcare organizations are not permitted to engage in immediate material cooperation in actions that are intrinsically immoral, such as abortion, euthanasia, and direct sterilization. Right? This is what they say to the footnote to 70. Any cooperation institutionally approved or tolerated in actions which are in themselves, that is, by their nature and condition, directed to a contraceptive end is absolutely forbidden. For the official approbation of direct sterilization and a fortiori its management and execution in accord with hospital regulations is a matter which in the objective order is by its very nature or intrinsically evil. Talk about scandal. It says the possibility of scandal must be considered when applying the principles governing cooperation. Right? We talk about, say, anybody that prescribes or gives out contraceptives, especially Catholic. Of course, this is why many priests are hesitant now to marry those who are cohabiting in a very large ceremony, because it looks like the church approves. It's okay. You look at the Catholic prescribing contraceptives and say, well, it can't be bad, because this Catholic doctor wouldn't be prescribing it. And really, the church must not really be against it, because I know I see this person at Mass on Sunday. It must not be a bad thing, otherwise he wouldn't be doing it. Again, it's a logical conclusion that people draw from people's behavior. If you're doing this kind of thing, then it must be, I see you, I think you're a good human being, you go to Mass, it must be okay. And you're leading other people into sin instead of away from sin, as opposed to saying, oh my gosh, that guy actually stopped prescribing contraceptives. He took a hit financially. He had a horrible time with his partners in his practice, and he wouldn't do it. Maybe I can be brave too, right? Maybe I too can do the right thing. Now these are the reasons. I'm sure you have other reasons, but often I hear from doctors reasons for prescribing contraceptives. There's quite a noble reason. They want to save a woman from unwanted pregnancy. They want to save the woman from abortion. They fear losing their respective colleagues. They fear the loss of income. Maybe there's other reasons. I once worked in a pregnancy health center, and as you know, I've committed my life trying to teach people why the church is teaching on contraception is wrong. Some 19-year-old came in when she was pregnant with her third child. And I'm ready to shout at her, get yourself a good contraceptive, for crying out loud. I mean, I know the temptation. I felt strongly. And I thought, but what the heck? If I say that to her, she's going to be back, pregnant with number 4. And pregnant, because, contraceptives fail, right? And she's going to be continuing a lifestyle. If I've got only 10 minutes with her, do I want to be one of the voices that say, well, here's something that helps you continue a lifestyle that's really bad? Or do I want to be someone who takes my 10 minutes to say, there's another way. There's another way. These contraceptives are not good for you. There's another way. You've got 2 children already. Maybe it's time to put a pause on the childbearing altogether. And what leads to that? Sex. Sex leads to that. So maybe that's what we need to deal with here. And I know it's hard. And I know you feel like you sound like an idiot because the whole world is telling this woman that what she's doing is just fine. Right? And you think there's an easy solution. But I say, no, I'm helping that woman take the next step down the path that got her here in the first place. As it tries to take her away from that lifestyle that's gotten her here in the first place. People say kids are going to do it anyway. Kids are going to they're going to have sex anyway, give them a contraceptive. They're going to go get it someone else. What matters if I give it to them? Well, we don't say kids are going to smoke anyway, so we might as well, I'll give them cigarettes and I'll give them low nicotine cigarettes, right? We say, no, it's bad for them. We're not going to give it to them. We're not going to tell them, well, if you're going to smoke low nicotine cigarettes. If you're going to have sex, well, at least do it safely, or at least quasi-safely, at least not as dangerously, well, maybe, I don't know, but use contraception. Kids are going to drink anyway. We don't say, well, if you're going to drink and drive, just wear seatbelts, or at least drive slowly in uncongested areas. Because if you're going to drink and drive, we want to minimize the damage that you do. So if you're going to have sex outside of marriage, at least contracept, because that will minimize the damage that you do. We don't say that. We don't say drive in uncongested areas. We say don't get drunk and don't drive, right? Because it's dangerous. I say, well, sex outside of marriage and contraceptive sex in general, it's dangerous, right? And we're sort of facilitating people living a bad lifestyle. Again, we say with drugs. We don't say they're going to take drugs anyway. Let us supply you with pure drugs. Okay, what are the reasons not to prescribe contraceptives? You listen to my tape, Contraception, why not? I go into this, but down the line, it's bad for the health of women. It increases the incidence of sexually transmitted infections using the lifestyle that facilitates it. It increases the incidence of unwanted pregnancy. It increases the number of abortions. It facilitates bad relationships. It harms marriages. It increases general social dysfunction. There's cooperation with evil. And again, it creates scandal. I mean, I know you're sitting there thinking, if I prescribe this woman with a contraceptive, then maybe she won't get pregnant outside of wedlock. Maybe she won't get an abortion. Maybe she won't go, maybe. I don't say, I think you're writing her a prescription for an unwanted pregnancy. You're writing her a prescription for a possible abortion. You're writing her a prescription for a possible STI. You're writing her a prescription for bad preparation and damage, right? So if you think you're going to keep her away from a danger, I will say you're giving her another push towards it. I met with a lady doctor who wants to, she prescribed contraceptives for years, and then her conscience convicted her. And she said she was amazed. These girls would come in and say, I want a contraceptive. This is a lot of years ago, so maybe it wouldn't be quite the same now. But she said, she's under a doctor. She said, I can't give you a contraceptive. It's bad for you. It's bad for you. I don't prescribe things that are bad for people. It's bad for your health. But you're not married. You're going to be having sex, and that you could get a sexually transmitted infection. You could get pregnant on wedlock. So it would be bad for you. I can't do this for you as your doctor. This girl could go to her boyfriend and say, I can't take a contraceptive. My doctor says it would be bad for me. Right? So we can't have sex. She wanted someone to help her say no. Right? She wanted that. Right? So it gave her that little bit more power to say no. Now, again, there are times when I know you prescribe the hormones and contraceptives for various conditions. And I've heard from many doctors there are many conditions for which that's really necessary. But the church does say that it's okay to prescribe the hormones that are in contraceptives for conditions for which it might be helpful. The church says this in Humani Vitae. It says the church, moreover, does allow the use of medical treatment necessary for curing diseases of the body, although this treatment may thwart one's ability to procreate. Such treatment is permissible even if the reduction of fertility is foreseen, as long as the infertility is not directly intended for any reason whatsoever. I'm sure many doctors can give a good testimony to different vitamins that can help women or natural sources of hormones, but sometimes I've heard that the hormones that are in the pill are maybe necessary for dealing with the symptoms. It never cures anything, but dealing with the symptoms with some conditions. But I want to make it very clear that those women who are doing that are not contracepting, and you are not really prescribing a contraceptive. You're prescribing the hormones that happen to be in the contraceptives. So I just want to insist that women who use the hormones that are in the pill for treating some legitimate condition are not contracepting. They are taking the hormones that are in the pill. Contraception involves doing something to interfere with the sexual act that has its direct intention preventing a sexual act from resulting in procreation. And that's not what they're doing. If they're taking the hormones in the pill to treat endometriosis, they may not be having sex at all. So how can you be contracepting if you're not having sex, right? And they're not taking it with the intention of making an act infertile. That's a side effect, a double effect of that action.